Hi guys, it's Dr. Hardy, your pediatric obesity expert. Thank you so much for tuning in. I'm relaxing today, reading my pediatric newspaper today, and I thought that I would start a little pediatric news brief series. So I was reading my pediatric newspaper. This is one that's endorsed by the AAP, American Academy of Pediatrics, and there was an article in here that was talking about minority children bearing the brunt of COVID-19. So I thought I'd go over the highlights with you, keep you informed, put things in layman's terms for you, and give you an opportunity to ask questions. And also the opportunity to get information that is evidence-based, okay? All the articles in here are evidence-based. So there's not fake news going on over here, people, okay? So, first sentence here says, Black and Hispanic children comprise significantly more cases of COVID-19 compared with white children based on data from a large cross-sectional study of 1,000 cases. So, when I'm talking about this is a group of 1,000 kids and the outcomes that they saw. All right, so let's go further to say, additional data further suggests that low socioeconomic status may further exacerbate health outcomes for racial and ethnic minorities. Further, overall, out of all of these kids, the 1,000 kids, 207 of them tested positive for COVID-19. Of these 207 kids, 46% were Hispanic. 30% were non-Hispanic Black, and 7% were non-Hispanic white. So infection rates were significantly higher among children in the lowest 3 quartiles of the median family income. Hispanic children were 6 times more likely, and non-Hispanic Black children were twice as likely to test positive for COVID-19 than non-Hispanic white children. Okay, so we do know there are some limitations to this study. One of them was that the clinician had to report the ethnicity of the kids, and so they may have misreported. So maybe they do not know the ethnicity or guessed it. So that could be something where the study may have fallen short. Also, the socioeconomic and racial disparities may be underestimated. So this basically means that the ones that truly need to be counted probably doesn't even have access. They probably don't have access to health care. So these are counting kids who actually can make it to the doctor's office. What about the minorities that, they don't have transportation, they don't have health insurance, they're in a very rural area and they don't have the access to even get there. So this is another area where the study may fall short. So although this is all evidence-based, you still have to look for things where the study could be improved. Where else? Although it was beyond the scope of this study to understand the causes for these differential rates of infection, the causes may be multifactorial, including but not limited to 1. Structural factors, 2. Poor access to health care, like I said, 3. Limited resources, 4. Bias and discrimination. So in addition, the high infection rate among minority children may be impacted by parents who are less able to telework, they are less able to find child care, or avoid public transportation. So I know that firsthand. We didn't grow up, with a silver spoon in our mouths. My parents never drove. We lived in New York City, so we could use mass transit everywhere. So public transportation is basically mass transit everywhere. They never drove. They never had driver's licenses. I've never drove until I was about 21 or 22 years old and when I got my first car. So being in the community that I grew up in, There were lots of people around, so there was overcrowding. We took, public transportation everywhere. So on the buses, on the trains, jam-packed. So, these poor communities tend to be in these situations where they're more likely to be exposed to more people, is basically what they're saying. So as the authors cite, this was not a research study of why these groups were more likely to be COVID-19 positive, but they speculated that the crowded living conditions, multi-generational families living together, and many minorities being essential workers unable to work from home may be why there are more minority people being affected. So some of these problems might be addressed by coming into communities in mobile vans, visiting community health centers and schools with free educational materials, using masks and hand sanitizers, and offering free access to testing. So what do you think can help with this, problem? What do you think can be done to help mitigate this issue in poor communities? Feel free to type in the comments what you think, or if you don't think this is the right answer, if you don't think they should go out into these communities in mobile vans and try to, vaccinate these communities and meet them where they're at, as opposed to expecting them to get to you or get the materials from you. It says future studies could confirm the cause of this discrepancy, as well as study community-based interventions and their outcomes. So I agree. I think this is a great study. Like I said before, children are getting COVID. Children are being hospitalized with COVID, and they are dying from COVID, just not at a rate that I guess is newsworthy to our mainstream media, because we're not really seeing that. I have seen newborns with COVID. I have seen pregnant mothers with COVID. And I think I'll go over an article with you from the American Academy of Pediatrics about the risk of pregnant mothers to their children.
So thanks so much, guys, for tuning in. Definitely remember to subscribe and tap that notification bell if you'd like to be notified when I've uploaded a new video. See you soon.